One. Sister Sylvia, we are live.
Good afternoon, good morning, good evening, and good night, wherever you might be in the world today. Today is a beautiful Sunday, and I am surely glad to be alive. And for those of you who are probably in hospital and are affected or infected with the coronavirus, we pray for your quick recovery and hope that, our first responders or our nurses and doctors, I'm sure, are doing the best that they can. And even to our first responders, please take care of yourselves while you take care of our patients in the hospitals, because we need you around and we need you alive to take care of us when we get sick. I know it sounds selfish, but we thank God for your lives and we thank God for all the work that you've done. There's been a lot of talk about what can be done or what is being done for the first responders. I am also very curious and want to know how we are going to be able to thank our first responders, because you guys are doing an outstanding job, including the people on delivery, people who are out there just taking care of everybody that is staying at home. Today, we have our special guest, Dr. Stella Emmanuel, who unfortunately is running a little bit late, about 20 minutes late. And we will try to cover for her or cover her spot for, a little bit of time until she comes in. So whenever she comes in, we will be able to jump off and let her, come in and give us her views on the COVID-19. Now, on the COVID-19, today's topic that we are going to be tackling is, was ending the corona lockdown premature when it was ended? Now, in the United States, quite a few states ended it, and I don't know if it's in full force, but I would like to believe that most of them are open and ready and running for business. Now, I'm based in Texas right now, so I can comfortably actually talk about Texas. As for the rest of the United States, I believe we had over 2 million cases of coronavirus, and I believe I don't know whether it's 125,000 deaths or new cases that are coming up, but I saw that number somewhere flashed. Now, when we're looking at such astronomical numbers, it becomes really, really alarming for an individual such as myself, because since the coronavirus, I very seldom go out. My beautiful sister, Reverend Pam, who is our chairman for the African Online Media Corporation, has been inviting me to go to Houston. And I have found every excuse in the book. Of course, now it's not every excuse in the book, but my car got into a wreck. So truly, I am grounded for a little bit here until further notice. But you notice that most of us are not going anywhere, or most of us are not visiting many people. But then how is this virus spreading? Once this opening or removing of the lockdown premature, that is our topic today for this COVID-19. Now, before I go on, I would like to first of all introduce one of our guests, Ms. Evelyn, all the way from Sierra Leone. She is, of course, part of the Africa Online Media Corporation now, and she's streaming in live, if we can see Ms. Evelyn. And then, of course, we have our chairperson, Reverend Pam Famanung, who also is based out of Houston, Texas, as I mentioned early on. Then we will be waiting also for Nkemleke, our main host, who also is running a little bit late. As we announced a few weeks ago, he also had some personal issues that he had to take care of at the house, and they're still being handled by him. So pardon his coming on late, or if he doesn't show up at all. I mean, we all understand, but we are looking forward to seeing him and to hearing from him today with our editor.
I'm here. Hello.
It's there.
My brother.
Hello. Hello.
Yes.
You
so
see me? Do you hear me?
And I will bow out right now. My brother, please take over. Niason.
Thank you, Sylvia, and thank you, Reverend Pam. Thank you, Evelyn. I know that you are well away from us, but thank you for keeping the appointment. It is a pleasure being with you this Sunday. So here we go. June 28th is the 180th day in the Gregorian calendar. 186 days remain until the end of the year 2020. On this day in 1776, the final draft of the Declaration of Independence was submitted to the Continental Congress in Philadelphia, paving the way for the proclamation of these United States of America. On this day in 1914, Franz Ferdinand, for those history students, Franz Ferdinand, Archduke of Austria, and his wife Sophie were assassinated in Sarajevo by a young Serb nationalist, Gavrilo Principe. This became the causa belli, or the immediate cause of World War I. On this day in 1919, some years later, the Treaty of Versailles ending World War I and establishing the League of Nations was signed in France. And on this day in 1971, for those of us who were born this half of the 20th or 19th century, whatever it is, and on this day, therefore, the United States Supreme Court, by an 8-0 vote, overturned the draft evasion conviction of Muhammad Ali, also known as Cassius Clay. But on this day, and on this last Sunday, actually, of June 2020, Africa Online Media Corporation is neither ending a draft nor getting into a boxing ring. Rather, we are stepping once again onto the coronavirus COVID-19 arena as the pandemic spirals and spikes. From the news, according to the Johns Hopkins University, we learned that the number of confirmed coronavirus cases around the world has passed the milestone of 10 million. The virus, which first emerged in China last year or late last year and spread across the globe, has led to almost 500,000 deaths. The surge in cases in southern states of the United States comes after businesses were allowed to reopen in recent weeks. And last Saturday, the states of Florida and Texas reported significant spikes, leading officials to tighten restrictions on businesses again. The leading United States government advisor on coronavirus, Dr. Anthony Fauci, says the spike sees the spike as, quote, a serious problem. This is even more worrisome, according to the head of the Centers for Disease Control, Dr. Robert Redfield, because, quote, the surge in cases is being driven by young people, those aged between 18 and 34, who are testing positive, especially in the South and West of the United States. End of that quote from Dr. Redfield. The situation is equally worrisome in Africa, where lockdowns were either slow in coming or implemented in a haphazard manner. There is no gainsaying the fact that COVID-19 is real. It is deadly, and it is spreading uncontrollably like some brush fire in the savannah. The best way of slowing it down is staying faithful to those measures recommended by the World Health Organization, WHO, the Centers for Disease Control, the CDC, and of course, these include the frequent hand washing, the using of hand sanitizers, wearing masks, and not touching your faces or one's face very frequently, of course, keeping your distance 6 feet apart from one another. Several governments in Africa should not go to sleep, and populations should not take anything for granted. As a popular saying goes, it is better to adhere to the health professionals' prescriptions and survive, rather than ignoring them and being sorry. Better late than never. Better accept the reality than regret the consequences. The uncertainties surrounding our world today oblige us to worry because, as humorist Irma Bombeck once wrote, quote, worry is like a rocking chair. It gives you something to do, but never gets you anywhere, end of quote. We worry, therefore, because we do not know where or when or how coronavirus will catch up on us. That notwithstanding, let us delve into our discussion today, aware that, quote, now is the time for a more scientific and analytical approach. As the physicist Marie Curie said, quote, nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. Yes, We better understand how coronavirus gets to where it does, that is to us, and how we can get rid of it, because if we don't, we will be the victim. And nobody wants to be victim anymore. 500,000 deaths are too many, one too many. And 10 million infected, that's too many for the world to continue to stay with and to accept. We cannot let that go. So let our scientists go to work. Let you and I raise the awareness, and let all of us say no to coronavirus, COVID-19. Sylvia?
Thank you very much, my brother. As always, very eloquent in your delivery and the accurate statistics that you have given. Thank you so much for saving my skin. Nonetheless, like you rightly said, what can we do as a people to help this spread, also not spread as fiery as you've just described, like a fire in the savannah? Rightly so. We have to wash our hands. We have to use sanitizer. We have to cover up our faces, our masks, and even this hugging and all this buddy business as well has stopped. So my question is this. We are talking about a first world, which has quote unquote everything that we need to make this a perfect life, so to speak, meaning we can follow and adhere to all these rules and regulations that will save us and will keep us alive and also prevent us from catching this disease. So let's turn the tables a little bit and go to the third world countries. A lot of African countries do not have running water streaming into their homes. A lot of these young ladies have to go walk 3, 4, 5, 10 miles to the stream to go and get water in buckets, and it's buckets and buckets and buckets. Imagine if you have a family of 10, and this one little girl has to go so many times back and forth from the stream. A lot of things from the stream, I'm sorry. A lot of things happen to her on the way, but she has to bring that water because we as a family need that water to wash our hands, right? We as a family need that water to cook with, to bathe with, to do everything that we do with water, even here in the United States. So how do we help our people who are in Africa with this water situation? Because as much as they can go back to the well or can go back to the river, how many times a day are they going to do that? And for sure, are they going to be able to cope and adhere to the constant washing of their hands? Let's talk about the sanitizer. Is the sanitizer readily available? Some countries right now in Africa have arrested their ministers of health because some ministers of health have misappropriated the funds that were pegged for their countries for this COVID-19 recovery effort or preventative effort. PPEs have been stolen, money has been redirected and stolen, and it hasn't gotten to the grassroots, to the people that need it. So how then do we help our people back home so that they also help stopping the spread of this virus? Reverend Pam?
Thank you so much, Madam President and co-anchor, and of course, Mr. Asonglefac Nkemleke, renamed me Asong by yours truly. And so we're all calling me Asong, you know, and Evie, faithful Evie, our fundraiser director, you know, from Freetown, where everything is free. I am really excited, and like the anchor said, Dr. Stella is still in church, but she'll be coming on shortly. She's our primary guest for today, and I'm going to warn you ahead of time, she's very passionate about this COVID-19. She sees about 5 to 10 patients a day, so be ready. But you know, Africa Online Media Corporation is not responsible for the content of what our viewers or participants say. We are not. You know, this is a platform for all Africans to express their views. You know, Madam President, you touch on something that we'll be announcing at the top of the hour with this water situation. We all know somebody made a comment, and I'm not going to say the name of the country, that this particular country on the continent does not have a single case of COVID-19. And the reason why they don't have a single case is because they don't test. So that doesn't mean that they don't have coronavirus or COVID patients, but they just don't test. That's why they don't have a single case, you know, and that is not even a laughable matter. But so we have issues on the continent. They're telling, everybody's talking, people are raising money for COVID-19, for PPEs and all that stuff. We're not going to be raising money for PPE. We are asking people to wash their hands. With what? What should they wash their hands with? Dirty water? And in the process of washing their hands, they contract typhoid and other waterborne diseases? No. So we have a big problem. And at the top of the hour, I will be going to details as to what we're going to be doing. As a matter of fact, this project has been in the queue for a couple of years, more than 2 years, but now is the time. COVID-19 has made it expedient for us to do this. But as Sister Sylvia said, Texas is in the red zone. Unfortunately, some people did not take this coronavirus thing seriously. I believe that they reopened too quick. Memorial Day, some people were barbecuing. 4th of July is coming up next week or so. And some people are still planning on going out there. You still see people walking around without a mask. Excuse me, at this point, I think anybody who walks around without a mask is selfish, because the mask that we wear is actually to protect the others, unless you are wearing N95 masks, then that will protect you. But most people don't have access to N95 masks. So I will want to encourage all our listeners, all our people, please wear a mask. It doesn't have to be a specific mask. You can make your own at home. Use a bandana, use your African scarf, just cover your nose and your mouth, and let's protect others. If everybody wears a mask, then we don't have to worry. We all know that, excuse me, physical distancing is what will help bring down that curve. Some people are talking about being on prophylaxis or whatever. I'm not gonna stand here and support any of that, because to me, I'm one of those people that, even though I'm a pharmacist by profession, I don't like to take medicines. I really don't take medications. That's why when I have a flu, I drink pepper soup. I don't like to swallow medications. I've always been scared of medicines since I was a kid. For some reason, I always think it will go down the wrong pipe. But we are talking about this spike in COVID-19 and coronavirus infection. I still believe that the numbers are underreported. I still believe so, because not everybody has access to testing. I believe that if we had adequate testing, those numbers will be it will be astronomical. So let's not joke with this thing. Let's not. I mean, a lot of people, you're complaining because you are being asked to stay at home. Okay, before coronavirus, people were complaining that they have not taken a vacation. When was the last time you spent time with your family? When was the last time? Use this as a vacation, or look for a way to work from home. I think it's Twitter that is investing money in employees to work from home, and I think Google is following. So our lives will never get back to normal, never. But I am going to, as you guys know, I'm very excited about the top of the hour, because we have some major announcements. I'm going to hand over back to Nia Song, and I'm going to try to see where our doctor is, if she's out of church. Over to you, Nia Song.
Thank you very much, Reverend Pam. And again, welcome back to the show. Welcome to the show, everybody. It's another Sunday. It's another day for us to tell the stories that we know about things happening on the continent. It is another day for us to raise awareness. So the spike in the numbers of people affected by COVID-19, what is going on? What happened? Well, we know that in the United States, especially, many states opened quickly, because people were preferring their Second Amendment or the First Amendment to anything else. They wanted freedom compared with their health. So they preferred to go out there and rock and roll and do everything they wanted, rather than staying safe, wearing masks, and keeping those distances. We saw beaches flooded with people. We saw bars. We saw people doing their things in the streets and so on, unprotected. Yeah, because wearing the face mask is perhaps one of the most fundamental ways of preventing it. And now we're seeing the consequences. Florida, for example, and Texas are two states where the spike has become rather notable and notorious, because these states were going down, but now they are going up. And other states, of course, I think there are about 19 states of the United States where the numbers are going up rather than going down. Back in Africa, I know that the African has always been skeptical about some of these things. I remember in the early days of AIDS, I remember a friend saying, until I see an AIDS cups, I will not believe that there's AIDS. But before he realized it, his next door neighbor was a victim. And then he realized that, yes, this paling person is not because he doesn't eat, he eats well, but because the AIDS does this to people, it makes people grow pale and so on. Then he said, oh my God, I didn't know that this is what AIDS does to people. So are we waiting to see COVID-19 corpses? Of course, there are many, many, many of them. I know in some African countries today, people are scared of going to hospitals because once they show their faces at the hospital, they are suspected of being COVID, coronavirus infected, and then either the doctors don't attend to them or attend to them from a distance and don't give them what they deserve. So it is up to all of us to be aware of the fact that this thing is real. As we said already, this thing is killing. Many, many, many people are dying, not because it was their day, not because St. Peter let open the gate before you could run to reach it, but just because you hurried yourself by not respecting those conditions that the World Health Organization, the CDC, and your own local governments have recommended. Washing hands, covering your faces, wearing your mask, that is wearing your masks, of course, and keeping that distance and making sure that you don't touch your face every second, because your fingers might have cut it from somewhere, might have picked it along the street on something you held, and then you rub your face, it goes into your nostrils and it goes into your lungs, and that is where the problem is. So Africans, all of us, we have to be aware, we have to be cautious, we have to be careful. Sylvia?
Thank you. We have Sister Evelyn as well from Freetown, Sierra Leone. Sister Evelyn, would you like to chime in, please, before I continue?
Yeah, I will just give a bit of update from Freetown. We were one of the last countries to have an infection, the first infection in early April. And up till now, we have about 1,400 cases, about 60 deaths so far. And some people are not convinced that it's COVID, but from the deaths we know, it doesn't hide. The data on deaths does not hide because we have a good IDSRO response system in the country, one of the best in Africa. Also because of the Ebola, from the Ebola, this country learned a lot on contact tracing. They're doing the contact tracing very well. But there are lots of limitations like testing. Only about 10,500 have been tested so far, while other South Africa of millions only have about 10,000 that we've tested so far. But the good news is that the deaths are not many, because if the numbers were increasing, we will see it in the data. We have IDSRO data, it doesn't show. So for Sierra Leone, the numbers are increasing but slowly, but the country is one of the best in contact tracing. Lesson learned from the Ebola response.
So let me ask you a question then. I know you're not a specialist, and neither am I proclaiming that you're a scientist or anything like that, but you are the boots on the ground right now for us. We're talking about Sierra Leone specifically because we did mention third world countries and Africa as a whole, and of course, Sierra Leone is on the armpit of Africa. So my question to you is, what do you think, I mean, the deaths, it's a beautiful number, 60, I mean, the ones that have died, I mean, it's not a good thing that they've died, but it's so good to see that it's, I don't know whether I should use the word control or if it's being managed well. And like you rightly professed and proclaimed, you said that with regards to the Ebola experience that Liberia and Sierra Leone and I believe Congo DRC Ghana as well. Ghana too, okay, Ghana
Guinea,
too, yeah.
Guinea and others.
Yes, and others that, you know, were on that belt of infection, yes, of Ebola. It's like you said, it's like a classroom that was started without even knowing that students were actually paying attention to what the classroom was, the classrooms were teaching. So looking at the way the numbers are so low in Sierra Leone, which is a good thing, and I'm praying that, you know, they stay that low. What are they doing that we in the Western world are not doing? Are they covering up more than we do? I mean, are they exercising the washing of hands more than we do?
I think that's one question which even WHO is still trying to respond to, because if we look at social distancing, our markets are crowded. People still go to the markets. We don't even respect social distancing. People don't wear face covers as they do in Europe. So maybe because we have the young population, maybe there's something in us, we don't know what's happening, but it will later, you know, we're learning the disease. And definitely in a few months, they're going to definitely have the reason for this. But where we have infections, when it's dictated. If you look at our data, most of our infections is in the city, the capital city, around the Freetown area. You know, in the suburbs, we have very few cases. Most of them are in the urban. And the contact tracing is key. They can really contact trace. But yet the infections are not as high as we expected. They are not. We don't have this.
Are they doing, I know some African countries are doing what they call, what's that word? Random testing. Are they doing random testing?
No, we're not doing random testing yet. No. So, we have, as I said, I've only tested about 10,000 and something testing. We only have about less than 30,000 test kits in the country. We've used only about 10,000 plus for now.
So what
only
about
test suspected cases.
What about at the airport, your airport?
No, the airport is closed. We've closed the airport totally. We had a lockdown. Yeah, we had a complete lockdown for a couple of weeks, and then we have medium lockdown where people could not travel to other districts. But now this week it's been opened. You can travel to a district. The shops are open till 1 p.m. There's no curfew anymore. But the airport is still locked down. Wow. We closed the airport. We have not resumed flights yet.
All right, thank you so much. Well, my people, you've heard our lady from Freetown, Sierra Leone. They're saying that they're not doing a lot of random testing. The airport is shut down. So could that be one of the reasons why this COVID seems to be what I would call seemingly under control? What I assume is under control, because with the numbers being as low as they are, the first initial cases, like Evelyn said, were initially reported in April. And to date, she's given us the numbers, the statistics. You know, it looks like the Sierra Leonean government or the Sierra Leonean people are doing something that the rest of us might need to replicate or mimic for those countries that have high cases of COVID. Nia-song.
Thank you very much. Evelyn, now this is for you. I know that Sierra Leone went through the Ebola. Would you say that the country drew some lessons from their experience during the Ebola to counter this COVID-19?
Absolutely. Because when the first infections came, as we recorded, they were all from people who traveled from Europe. Those were the first cases. All of them were travelers from Europe. And when we locked down the airport immediately, you know, there was a bit of control. Then some of them were already in country, they started getting the infection. And the lessons they got from Ebola, they have really been very helpful. That's why they're very strong in the contact tracing. They can trace right to the 100th, 200 plus. You know, they can trace all for every case that we have. You know, we have a lot of lessons from Ebola. Nonetheless, we're challenged because we have issues of water. We're talking about water, washing of hands. I do wash hands where I do my response, where we work. We have over 510 facilities, and less than 40% of them have water, but they're hand-dug wells. Hand-dug wells, you have to pump. It means there's no running water at the facility. So we have our challenges, and we really pray. We are dealing now with trusting God that it remains the way it is, it goes slowly. That's all we do here. But we think the situation is really, if it increases, like we see in other countries, it will be really terrible.
Is it raining in Sierra Leone now so people can collect rainwater and use as rather than waiting for the stream?
It's raining, but it's not heavy yet. It's not daily. It's like twice a week or once in a week.
Okay.
In the districts, it's not even raining at all.
Yes. Okay. It looks like somebody's on the line.
Not yet. But I'll go after her.
Okay.
May I chime in for a minute? You said that the water in Sierra Leone is pumped water. You're talking about those big the
wells, the hand-dug wells.
The wells.
Yeah, where you pump
most hand-dug wells, yes, at the facility. So you can imagine, even the staff, how would the health staff wash his or her hands?
That's what I was about to ask.
So challenging.
Cross-contamination, because if the last person that was there held it and they had the coronavirus,
exactly,
may not have it, and he or she may touch it, and that the spreading.
Exactly.
So then what are they doing to curb that? Because if this thing, the handle, the pumping mechanism that is being used is not being sanitized, but then the beauty of this whole thing is the contamination is not that big or that bad. I mean, there's something here that I think we're not getting, that Sierra Leone is doing right.
I think we closed the airport very quickly.
Yes.
Reduce the number in country.
People
We closed
coming
the
in.
airport very quickly. And at the time we closed the airport, we quarantined almost everyone who came on those last flights. And the infection started coming from those who were quarantined.
I got you. Okay.
Now,
right.
I have a quick question again for Evelyn. Now, the problem with Africa is we don't have those industries that manufacture some of the things that are needed at this time. But have you, going around town, been able to see people setting up maybe hand washing places, or using maybe, I don't know, something to fabricate some sanitizers that can be used even if they're not commercially being sold?
Yeah, yeah. Hand sanitizers are the easiest to, hand sanitizers are one of the easiest to produce. And in most African countries, they have been producing hand sanitizers. Okay. And Sierra Leone has joined. We have joined right now as well in producing hand sanitizers, like most of them. But also fabrication of some of the PPEs. Yes. Some have started. Most African countries have started producing a few of them. But but they have challenges. We're still relying on importation. And these are consumables. There are consumables at the facilities. I'm in the logistic department for the restaurants. We're dealing with IPC and PPEs. There are consumables, quantities come and they have gone in no time because they don't reuse them. It's like disposable.
Okay, I am kind of concerned with what I just heard from Evie. You work for an organization, and if you guys don't have access to potable water, I can't even imagine what the people in the village and the remote areas, even the cities, can do. And it's a good thing. Our event is going to be focusing on this water thing. I am kind of disturbed. But while I applaud this,
you're cutting off, Reverend Pam.
Can you guys hear me now?
Yes.
Can you guys hear me?
Yes, I can hear you.
Oh, okay, all right. I apologize for that. But I'm saying that while I applaud the Sierra Leonean government for shutting down the airport and tracking and tracing those people that came in and quarantining them, you said you guys had about 30,000 test kits and only 10,000 has been used. I am kind of concerned because there may be several people that actually got it and died and they were not reported, and some of them got it and recovered and it was not documented. But this water thing, it is expedient now for Africa Online to do something about this project that we have had in the queue. Again, I mean, like I said, I did not even know prior to this airtime, the information is just shared, and that is mind-boggling.
It is
very, very disturbing. She works for an organization, a viable organization, and less than 40, I mean, about 40 out of 500 facilities have access to manual wells. I mean, on here, and we need to stop. Okay, in the US, several breweries have converted their facilities to from manufacturing liquor to manufacturing hand sanitizers. I know a country like Cameroon used to be the second largest consumer of beer in the world, next to Germany. I don't know what the statistics are now. I've not even heard that any brewery in that country or in another African country has converted their brewery from making beer or liquor to making hand sanitizer. I'm talking about life-saving. Instead, in some of these countries, I actually saw some people put a hole in their mask around the mouth, where the mouth is, so that they can wear a mask and still drink beer. That doesn't make sense. I mean, it is pathetic. This is the truth. I saw it in Cameroon. People are putting a hole around the mouth area, and it defeats the purpose of having a mask. The mask is not just to close your nose, but also to close your mouth, because you actually inhale your mouth and also through your nostrils. You know, but it defeats the purpose. People don't realize
it does.
This alcoholic thing is alcohol is a drug, is an addictive demon. And here we are, instead of using those equipment, you know, or facilities to manufacture or mass produce hand sanitizers, they are still selling beers. They're still selling beer, and then people are compromising the mask that they're supposed to be wearing to protect themselves, to accommodate the addiction to
drinking.
But also
go in a different realm. Let me hand over to Niason.
Okay.
Thank you very much.
Can I just say something?
Yeah, sure.
Can I say something? Yeah, what I'm saying, but even we haven't reached the level where we need to really go to like big companies to start producing hand sanitizers. As I did mention before, the production of hand sanitizer, it's a simple technology. And we have lots of laboratories, universities that are producing hand sanitizers. So it's not quite a problem. We have a system called IDSRO, Integrated Disease Surveillance Response. It's something which I don't know if they use in America. We use it for public health studies. They use it in Africa a lot. When their deaths are there, they will not hide. We get them. It's done every week and the report comes down. We haven't got those spikes, those deaths that can show us that something is happening, even though we're not testing. It's not showing in that data yet. So I think there's something different that is not really happening around here, which we haven't discovered, but the deaths are not there. Maybe most of us are symptomatic.
No, let me say something, Evie. Yes. Let me say something. I beg to differ with that. In Sierra Leone or maybe Freetown, they may have enough hand sanitizers. The average villager doesn't have access to it.
No, that's true. They don't have. We don't have. But I mean, the deaths are not there.
If they did, then the water will not be such an emergency.
Yeah, we don't have. That's true.
Okay.
Wow.
Well, thank you for that, and thank you for standing up for Sierra Leone. We are very grateful for that. Now, Sylvia, have you had any news from Zambia? What is going on in Zambia so far?
Yeah, as of I think last week, not this week that passed, but the other one, there was I think in one day, if I'm not mistaken, they had like 10 new cases, but since then I haven't heard any reports because normally they send it to me. But however, I would just like to share the same thing that Sister Evelyn just said about Sierra Leone. Zambia is a little bit more on the, I won't call it advanced, but we do have running water, tap water in most of the cities, except of course the villages, like we said, the rural areas. But some rural areas that I know of, most of them have boreholes, you know, the borehole where it's a common also a place, you know, where that has that handle where people can still get water. But from the borehole, sometimes they have these tanks, and then from the tank, of course, you got a tap. So Zambia also had closed down the airports. Zambia has four international airports. There's Lusaka, there's Livingston, there was Ndola, and as well, I think, is it in Mfuwe? I don't know if Mfuwe is still operational. The president declared all those airports closed except the Lusaka International, the Kenneth Kaunda Lusaka International Airport. So what this means, well, what has this translated to is, I believe the people are still flying into Zambia. However, the president has issued what they call a special initiative, an SI, which means that if you decide to fly to Zambia, be ready to quarantine yourself for 14 days at your own expense. There's an Indian group or an Indian family that gave Zambia a certain facility. I don't know whether it's an old mosque or an old school, where all these people are being housed until the 14-day quarantine. So right now, with correct figures right now, my brother, no, I cannot give you that as of this past week, but I knew of the previous week. But I believe it's also under control because in Zambia, it's life as usual. They have restricted gatherings to 50 people at a time. We just had a wedding for my niece who got married. We have another one getting married in 2 weeks. And only, I think, 30, 40, 50 members attended the wedding. But again, that was also controlled. If I share the pictures, everybody had masks, including the bride and the groom. They only took them off when they were, you know, you may kiss the bride. And then, of course, you know, they kept them on their neck so that people could take pictures. But the rest of the people, you know, that came, they had gloves and they had, you know, the masks and things like that. So I believe the practice is holding, but the market center or the center market is not. People are just doing business as usual. So I'm not sure how people are not being infected like that.
Yeah, I've not heard much about Cameroon, but all I know is that Cameroonians are good beer drinkers, and they opened up before individuals opened up even before government could do anything, and we could see people socializing in bars, in nightclubs, and so on. I asked myself, what is going on here? So, but I understand now that if they catch you on the street without a mask, you pay as much as 5,000 francs.
That's correct.
I don't know how much that would be in dollars.
2,000, but people are wearing a mask in Cameroon.
People are beginning to
Zambia has 1,500 cases right now. just over 1,500.
Cameroon?
Deaths. Zambia.
Oh, 1,500. Okay.
Yes, and 26 deaths from the data we have.
Okay. Well, that's it. So she's more apt to that than I am. Like I said, I base upon what my family, family members share with me. Now, when we're looking at Africa and the way that the Africans have controlled the, let's say the pandemic, the disease, is there something, as we're talking, the four of us, we're all from Africa. And of course, Evelyn is the boots on the ground right now with real data, real time. We are here and are being fed by whatever information that we're getting from the rest of the continent. Do you guys believe maybe there's something in Africa that is helping not to escalate? Or, I mean, I don't even know how to ask the question without making a stupid or assumption. Because I think it was Melinda, or was it Melinda Gates, who said that Africa should prepare itself for a grave, death. In other words, so many people. I think she made a quote which I can't really remember because it really upset me, and I had taken it out of my head, and I said it's not Africa's portion. Now they're predicting, she was predicting, or rather prophesying, if that's the right word to use, that Africans are going to die in the numbers. But this is not the case right now. Are we maybe expecting a second wave?
I need to jump in.
Yes.
We're still in the first wave.
Yes.
But the problem is the advantage that Africa has is we have a lot of young population. Today I talked to my cousin, my nephew, in where he works in his workplace. Many have tested positive. They are youths, but they haven't been to the hospital. They were not treated in the hospital because they're mild, very mild. They're not even sick. So the young population is an advantage for Africa. That's one thing which I know. It's an advantage. I mean, asymptomatic cases.
Okay, Dr. Stella is about to long bit, but I want to put a disclaimer there. I don't think our young people should be complacent because the US here, they have tied this multi-system inflammatory syndrome in children, to COVID-19. The fact that those particular youth have not gotten sick doesn't mean that the young people are immune to it or they have better.
No, they are symptomatic.
No, I know that, but we need to discourage our young people from thinking that they are untouchable, because the same thing that happened with HIV. So we are going to caution all our young people, practice good personal hygiene and physical distancing. Because the young people in this part of the country can maybe get away with it better than you on the continent. Another thing could be maybe because of the malaria that has been part of life on the continent, and a lot of people had built antibodies to this chloroquine. That may be helpful, but we don't have the data.
Evidence.
We don't have no data, no scientific data, so we will not. That was just an observation. I want to caution all our young people, old people, whatever. Protect yourself. Stay home unless you have to go out. Stay home. Our guest is about to zoom in. So as soon as she comes, she will have a few minutes before the top of the hour because we have some very important announcements. She just tested that she's logging in. Okay, there she goes. So Nia, so I'm going to hand over to you, and we'll give Dr. Stella the airway. She's actually connecting her audio. God's work comes first, even though this show is also ministry, because we are ministering to God's children. So as soon as Dr. Stella unmutes her phone, okay, there she goes. So Nia Song, let me hand over to you so you can take it with Dr. Stella.
Hello, Dr. Stella. Good afternoon. Welcome and happy Sunday.
Dr. Stella, you need to unmute yourself. I'm trying. Okay, she's unmuted.
Okay, 1 minute. I'm still trying to get my video right.
Okay. Okay, we see the top of your head.
We're seeing the ceiling.
I know, right? Just hold on.
Yes, please. Thank you.
Welcome, Dr. Stella.
We just lost her. I think she's going to zoom back in. But this, I am still very concerned. Even you mentioned the marketplace. There are some things that we cannot do on the continent. There are something.
There are many. It's challenging.
The marketplace. But the other thing too is another challenge that we've heard about on the continent are some healthcare workers. While we appreciate what they do every day, some of them are afraid to touch patients, understandably so. And there are patients that have been misdiagnosed, patients that had malaria or typhoid, you know, and just because they had a temperature, they were declared or labeled as COVID patients. And, and in some countries, I'll name Cameroon in particular, if you die of COVID-19, they're gonna take your body. The government will confiscate your body unless your family is able to bury that person within 24 hours. They will take your body and put you in a mass grave. The family will not even see you. So we want to send a plea out to our government. Please, family members need closures. Even though cops have been shown to have coronaviruses, let's give people closure. Let's be humane. Let's be merciful to the family members. Let's not discard corpses, COVID-19 corpses, as if those people did not matter. Please, because what is happening now is that there are some people that really need to go to the hospital, but they're afraid. They're afraid that when they go there, they might be quarantined, their family members will never see them again. They will not even get the right treatment and they die, and that will be the end of it. And that is such a shame. That's why information is so important. Information is really vital. Again, we are waiting for, I'm going to hand it back over to Niason, but as soon as Dr. Stella comes in, I will interrupt whoever is speaking. All right, Sister Sylvia.
Before Niason takes over, can I just give you guys another angle of what I found out or what I heard? Yeah. As much as we may plead for the hospitals or the governments to be humane to the families, yes, some of the families are refusing the bodies of their people. They say they don't want to, how you call it, contract the disease, and they don't want to. Yes, exactly. So there have been cases that I personally know of that right now, maybe I can count 10 on my hand, where the bodies were just now, like you said, taken and, you know, just discarded by the government because the families refused to take them. Oh, so no. It's a two-way stream. It's true. They should give us the option as a family. Would you like?
Stella is on.
Thank you. Would you like? And once we say yes, they should give us the body. But then what about those who are refusing the body? Hey, Dr. Stella.
Hello, good afternoon.
Hey, good afternoon, everyone.
Welcome back to the show. And please.
Yes, I know. I'm a pastor, so Sundays are usually a little dicey for me to get out of the church time to get with you guys.
Okay. Our topic is centered on the spiking of this disease, that is the increasing numbers, that the new numbers that are coming up rather than going down. So we figured out that today we should talk more about it. Why is it that this thing is coming back rather than going away?
It never went away.
Okay. The numbers were going down at one point and then turned around. And
this is the thing, right? When you do social distancing, you stop this. Okay. Let me go back. You know, in March, when they talk about social distancing, when you do social distancing, you're not trying to, one, stop the spread of the virus ultimately anyway. Number two, it doesn't actually mean you stop the amount of people that will ultimately die anyway. The social distancing stuff was implemented to stop the spike being so steep that it overwhelms the hospital. That was the main issue about the social distancing. At any time that we went back to regular life, it was going to spike, whether it's now or in the future. Because when we go back to regular and there's a spike and there's an increased viral listing, that is how people are going to eventually form herd immunity. But here's the thing. In March, when the spike happened in March, number one, we didn't know who this virus was. We still don't know enough, but we know some. Number two, our hospitals were not prepared. We did not have PPE. We did not have personal protection. You cannot find masks in the stores like you can find now. You cannot find hand sanitizer and other things. Number three, the hospitals were not prepared. We did not have enough ventilators. We did not have enough ICU beds. We did not have enough anything. So the shutdown basically was to flatten the curve. When they mean by flattening the curve, in other words, instead of everything just spiking up like it's spiking now, they got the curve a little flatter so that it should go over several months. instead of going over immediately. But now, the thing about this particular spike is that even though there's a higher spike right now, the rate of hospitalizations and the rate of death is much lower than it was in March. And this is what we're looking at. Number one, when it spiked up in March, it affected mostly older people and more vulnerable people because at that time we did not know anything about this virus. We did not know that if you're vulnerable, you should stay away or you should hide. We did not know that people in the nursing homes are more vulnerable. So because we did not know that information, those people were still, everybody was exposed equally. But right now, this spike right now is happening. Of course, we all know. Remember in March, all of us said that, well, New Orleans had a problem because of Mardi Gras. And they said it was because of, some of the things they did in, people were going around and, in Italy, they had this, greet a Chinese, hawk a Chinese day or something. Those were the things that made this particular place spike that much. Of course, in New York, people live on top of each other and, people are tied up together. So the spike in March took place because nobody knew anything and everybody was infected. And of course, those that were more vulnerable, they were adults, past died. Now, for the past, since we knew about this, first of all, nursing homes are being more protected right now. Number two, those that have diabetes, have medical problems, they know better than the outside on the streets, having a power high or whatever. Now, in this country, for the past few weeks, which is one of the reasons why it's been a little crazy, is that our leaders told us that if you go out on the street, if you cannot go out, you cannot have meetings more than 10 people. We all heard that. You cannot have meetings more than this or more than that, which is true. They knew that if we go outside and we start communing and hanging around and with no social distancing and just, it's going to really, really spike up the spread of the virus. And then, of course, a few weeks ago, this guy was killed, and then they started the peaceful marching, which resulted in some rioting. And then they had Memorial Weekend, people were out on the beach. Memorial Weekend, people were out on the beach, partying and everything. So, of course, all those events were going to have the virus was going to come like 2 weeks later. And of course, if there's going to be any serious death toll, it's going to lag behind too. So now the spike right now is the demographic, the average age right now is in the 30s. Because of the current demographics, even though there's a huge spike in the disease, there's not as much hospitalization as it was in March. And the death toll is not that high. In fact, in many states, the death toll is still going down. But of course, the death toll is a lagging index. So we might see in the next 2-3 weeks to see whether these 30-somethings that are getting infected are going to die or they're just going to ride it up. So that is probably what this spike has become. Is this spike scary for me as a physician? Not really. The reason why it's not scary to me is that I know that it was going to happen either way. I think it's better to happen now than if they opened up in the fall when we can't tell whether it's the flu or it's coronavirus. In the clinic right now, like yesterday, Saturday, usually we get off at 1. I didn't get out of clinic yesterday to 6 p.m. We saw about maybe 12 patients with COVID. We're seeing an average of 7, 10, 12 that we're seeing every day and treating them, And so this spike right now, it affects young people, and it's going to happen because people went from being locked down to just totally losing it and going out there and partying and going out there and to the beach and going out there and marching and going out there and doing all these other things. So I don't know what's going on. Can you guys see me?
No, doctor. Yeah, we're seeing you. We're seeing you.
Okay, good.
Now, what would you tell an individual on the streets of, say, Lilongwe, Yaoundé, Douala, wherever in Africa?
Okay, we've been doing a study. We're putting together a study right now. I'm working with 2 different companies, with 2 different. One of them is a lady doctor in California that does. She does stool studies. She does microbiome studies on stool. And we have just been evaluating some data that she just got, which is going to be published soon. I'm going to be part of the data because I'm getting data out of my clinic. When she did that evaluation, she actually just evaluated 15 patients, their stool, and found out that the virus, of course, was secreted 100% in all patients. And then they did a genome they actually did the genome analysis of the various viruses, and they found out in those 15 people, they actually found out 5 different strains of virus. That is why I don't know how they're going to get a vaccine, because RNA viruses are pretty difficult to find a vaccine. You've not been able to find a vaccine for HIV, for common cold. This coronavirus, yes, common cold, they have not been able to find. So I don't know how they're going to do this. They tell me that they're going to get a vaccine. I don't know how they're going to do that. So they found 5 different strains, and among these strains, they could differentiate them by on what particular area on the RNA did they have like a spike. Like the viruses that had like 2 or 3 spikes had patients that had more deadly diseases that were more sicker. The ones that did not have a spike or did not have. So I mean, she had a very awesome analysis. And these are the other things that she found. She found out that number 1, all these patients that were sick, she also made sure that their family members, some of them got on which is what the article was discussing, we're about to publish on. Some of them got on hydroxychloroquine and zinc prophylaxis for the family members of those that were treated, that were sick. And then they eventually evaluated the family members, checking them for antibodies and disease. They found out that those that had the prophylaxis of hydroxychloroquine, they did not get the disease. Those that did not, a lot of the family members end up contracting the disease. Some had subclinical infection, but they had antibodies. They also found out that those that received treatment of hydroxychloroquine, zinc, and Zithromax, within 10 days, 100% of them stopped secreting the virus in the stool. And the other ones, at 2 weeks, 3 weeks, they were all still having viruses in their stool. That's the other thing. That is like a total, and these people, they were all treated early. So, and they found that. So these are some of the things that we're getting. Okay, for me, I'm seeing patients in the clinic. I'm seeing like 7 to 10 patients per day. If they were to ask my opinion right now, we're about to do a video with other physicians that have been working in the front line with me. And we're going to be analyzing a lot of the studies and a lot of the studies that have been published. Number 1, the study that was published in Lancet, that was a total foul. It was, the data was wrong, it was fraudulent, and they've retracted it. And one of that study that was in the New England Journal. The study from Lancet that they had done, they analyzed almost 100,000 something people, it was fraudulent. And they could not, the data was fraudulent. So because of that, WHO kind of stopped the studies that they were doing, but after they retracted, WHO has restarted the study. So those studies, listen, the sample of 15 is not too small for what we're doing. You understand? So we're still doing it. We're still doing it. Sample of 15 not too small for a stool study. So the study that caused them to retract the WHO to stop hydroxychloroquine study has been found to be fraudulent, so they are not going to use the Lancet study anymore. Now, there was a study that was done in the VA. That study was done among they were done among patients that were sick, that were too sick, were already in the hospital, and that study didn't work. I spoke to a doctor and also to my brother that work in hospitals, and they've had some studies. They are seeing a lot of good response to remdesivir in some hospitals right now, and so we're looking at that, and we're going to be talking about that too. And then we're talking about, then they did a study in Minnesota. A huge study was done in Minnesota, and this study was done to give prophylaxis to people that were exposed to COVID. They gave them prophylaxis, hydroxychloroquine and zinc. But this study, the patients that were in this study were given the medication 4 days after exposure. And they found out that they did not have any real difference between those that got infected and that didn't. It did not seem to work. But that study did not cover people that were on the medication prior to exposure. So those are some of the studies that have been out that are on this thing. Recently, the FDA took away the the emergency authorization use on hydroxychloroquine, and so because they found out that it doesn't really work in the hospitals, and we don't really expect it to work in the hospital because of the sheer mechanism of action of the medication. So that's off. So right now we can actually, with that, the stockpile can be released, and of course doctors can see it off-label. So now, what do I say to people that are scared right now? This is what I'm saying to my patients, and like I said, I see. My experience I would say my experience is extensive. I've seen over 100 patients or more with this disease, and I've treated many of them. And I found out that when patients come to the clinic that present within the first 2-3 days of treatment, within 24 hours, they are better. Our regimen is hydroxychloroquine, Citromax, and zinc and vitamin C. We give them a steroid shot, put them on Metropack. We give them Kenalog and put them on Metropack. Luckily, they just found out that dexamethasone work. We've been doing it. So
Dr. Stella, I hate to cut you short. Right now, I'll let you continue at the top of the hour. We have some major announcements that we have to make today.
Sure,
so, Reverend Pam, please, Nia Song, when you're done with the top of the hour announcement, can we have our guest continue with her delivery of such beautiful information?
Sure.
Reverend Pam?
Yes, thank you. Can you guys hear me?
Yeah, we can hear you.
Yes, I had to put on my headphone because for some reason, the lawn guy decided to mow my lawn while we're on the air. So I don't want that sound on this show. That's why I'm putting it. It just happened to match my lipstick. You can tell that's my favorite color. But anyway, yeah, thank you. And Dr. Stella, I'm glad you pressed your way. Yes, I was telling them God's work comes first, but this show is God's work. It's reaching thousands or hundreds of thousands of God's children with information, life-saving information. And by the way, I do have a virtual background celebrating Father's Day. So if you see some black stuff around my face, that's not part of my makeup. It's the virtual background. Let me just warn you guys, because the first time I saw it, I was like, what is that? What did Sister Sylvia put on my face? But it's a virtual background. But anyway, I am so excited because we are actually going to be having our first virtual fundraising concert. And guess what it's about? We have actually decided to do this for Operation Borehole 55. That was a name that the Lord dropped in my spirit 3 years ago while I was having lunch. And hearing what Evelyn said today about the water situation just made my heart sink. It's expedient that we do this. Again, a lot of people are raising money for PPEs. We are not raising money for PPEs. We are raising money for water, Operation Borehole 55. And the 55 stands for the 55 member nations of the African Union. There are some other countries, smaller countries that are not part of the African Union. But I am going to be giving our team members maximum 1 minute to speak. And I knew some before you came on, I told them you were very fluent in French. You are a bilingual person. So I would like for you to talk about the fundraiser in French, because the rest of us here did not like the French language. So even though we took it in GC, but we're not fluent in it. So I know you had no choice, but we're also going to have the best DJ on the planet, DJ Skipper, playing live music. He will actually be on this show next Sunday to talk about what you can expect. We are going to be putting a playlist together, and he is very bilingual, trilingual. He's fluent in English, French, Pidgin, and some other dialects. You know, he's also a performer. He plays music of all genres. So you are in for a major treat. On August the 1st, we're going to be having a virtual fundraiser. So if you want to be part of it, part of the planning, inbox us. If you would like to perform, inbox us on Facebook through Messenger, or you can post it on our Facebook page. Excuse me. If you would like to donate, African Online Media Corporation is a 501c3 organization. You can make a tax deductible donation. And also, if you want to be a speaker, inbox us. We also have a magnificent couple where they're not husband and wife, but they're going to be co-moderating. So you are in for a treat. It's going to be a virtual concert like you've never seen before. So let me go to Sister Sylvia first, then Sister Evelyn, and then Nia Song. And Nia Song, you cannot speak in Bangla or English. You have to say it in French. Sister Sylvia.
Yes, well, Reverend Pam, apparently you've probably covered everything, but just to add on 1 or 2 things. With regards to our fundraiser, yes, we are going to start putting boreholes in the, pray God blesses us and we go to all the 55 African countries, but we will be selecting them as per priority, the ones that do need, like we had Sierra Leone right now, it has changed the whole dynamics of what we had intended to do the first time. And I mean, when you don't travel to these countries, you really don't know what is on the ground until somebody who has boots on the ground, you know, educates you and shares what, you know, the traumas or the stresses of the country are. At the same token, we'll also be advertising space. If you want to advertise your business, your company, even yourself as an individual, you want to come do something that you want people to know, please feel free to get in touch with us, and we'll be able to give you that half a minute or 4 minute space. However, the advertising space is not for free. We are fundraising. And those of you who want to advertise may say, well, why should I have to come on this show when I can just put it on YouTube? I can put it on Facebook. Yes, it's true. You can do all those things, but guess what? We're going to have an audience that's going to watch this from far and wide. And we pray that those people that are watching will be generous enough to donate, because this fundraiser that we're doing is for Mama Africa. We do need to bring that water home to our families. We do need to stop our girl children from walking 50,000 miles every single day back and forth, getting bit by snakes, being raped while they're on the way, being attacked by dogs, by humans, and so forth. So please donate, be a part of this show, even if you're not donating anything, but just your support. We'll appreciate your support and even your kind words of encouragement. Like our chair lady said, if you're interested in being a part of this show, please feel free to get in touch with us, whether you want to present, whether you want to speak, whether you want to dance, whatever artistic thing you have out there that you want to share with us that will enhance our viewer population, we would really appreciate it. Sister Evelyn?
Yeah, okay.
Yeah, talking from Africa, I've been in development for the last 14 years, working in West and Central and East Africa, in a couple of countries. And the need for water is enormous. Epidemic control is about water. To control epidemic, we need water. And this need is enormous in Africa. It's not just in Sierra Leone, it's across Africa, across many other continents, especially in sub-Saharan Africa. So if we can help our communities, it's not just about our communities, the facilities. Can you imagine a health facility without water? That's what we're talking about. Communities lack water, health facilities lack water, and here is COVID. How can we prevent COVID? How can we help the control if there is no water in the communities? So we'll be calling for our brothers and sisters, our parents, and they, to be donors, especially because it's all about money. It's an asset. Boreholes is asset. And in some communities, it's not just about the borehole. It's also about the power that drives the water. So in some will be doing solar panels as well. Because if we install a borehole in a community that does not have power, there's no way that borehole is sustainable. There's no way that water will run in the facility. So it may come with a solar panel as well. So yes, we'll be coming up with all these details, to share so that you can see the needs in Africa. Thank you.
Thank you.
Awesome. Niason.
Oui, merci. Mon directeur m'a pris du coup comme ça que je vous parle en français parce que Africa Online Media Corporation va organiser un collecte de fonds, on appelle ça peut-être un coup de cœur, pour sponsoriser les adductions d'eau dans les 155 pays d'Afrique, ou plutôt les 55 pays d'Afrique. Donc, ça sera le 1er août 2020. Donc, nous vous prions de se connecter avec Africa Online et de nous assister à collecter ces fonds pour construire des adductions d'eau, vu que le coronavirus demande qu'on lave les mains et il n'y a pas suffisamment d'eau en Afrique. Donc, nous vous prions de nous assister le 1er août pour organiser cette collecte de fonds. Ça s'appelle Coup de cœur. Opération Coup de cœur pour des adductions d'eau. I know Dr. Bodje may not understand French, even though he was born and raised in Cameroon, but that was Asonglefac Nkemleke trying to say something in French about the fundraiser that we're holding on the 1st of August. So, Dr.
Okay, Niason, thank you so much. Going forward, I don't even know why I kept forgetting. Every time I make an announcement in English, you need to come in and say it in French on this show. Because we are reaching,
that is,
where French and English are the primary languages on the continent. Hopefully, we'll have somebody that speaks Portuguese, what's this other one? Swahili.
No,
Swahili,
but for North Africa.
Yes, North
Swahili,
Africa. Yeah. Actually, we have somebody that speaks Amharic. Amharic. Yeah, so she was supposed to be on this show, so she's part of the fundraiser. But Sister Evelyn, what you touched on, solar panel is actually one of our projects. So yes. So we're going to make sure that those boreholes are operational. We're not going to be depending on the government power system. You know, in Nigeria, even though they've changed the name, they said NEPA stands for never expect power at all or anytime. That's what the company stands for. But that was anyway. So Dr. Ogoji is on, Dr. Stella is connected.
Before that, Reverend Pam, you forgot something. You didn't tell us what topic we're tackling next week, which will be the first Sunday in July.
Oh, in the month of July? I'm so passionate about this. We're going to be talking about investment opportunities during this pandemic. A lot of people, millions of people are unemployed. You know, so we're going to be talking about investment opportunities, job opportunities, employment opportunities, and unemployment among our people, both on the continent and in the diaspora. You know, during this COVID, a lot of our young people have become more innovative. You will be shocked what our young people have come up with. So we're going to try to be discussing that, but let's give Dr. Ogoji and Dr. Stella the rest of the time. Dr. Niason, Dr. Ogoji, over to you.
Yeah, he's there. I see him on the phone. Dr.
Can you hear me?
Yeah, we can hear you.
We can hear you, but we can't see you.
He doesn't want to be seen.
No, oh no, we see him with his hat, with his cap today.
Okay.
Can you see me now?
Yes, sir.
Yeah, there you are.
Can you hear me? Okay. So, what are we talking again this Sunday again? Sorry, guys.
Spike in the coronavirus COVID-19. Why and what can be done to stop the spike?
The spike, okay.
Yes.
Well, to stop the coronavirus, there are two approaches that one has to follow. One is complete isolation and lockdown. Another one is protecting the more vulnerable population, the elderly, the people with pre-existing condition, and then hopefully allow herd immunity. Herd immunity that people get infected and develop immunity and will go past this. The way things are going now, the coronavirus has come to stay. The problem is, how can we prevent the most vulnerable population of the society from getting it and dying? And one way is vaccination, which we know is not coming until sometime early next year, if any. And of course, shutdown, we've tried to shut down the economy before. It's an option, it's not an option. People have to feed, people have to eat, people have to take care of family. So nobody's listening to shut down the economy. And we need to actually see, you need to live in a border city to see the dynamic of what's going on. Yesterday, I traveled 30 minutes to a city called Coeur d'Alene. I live in Spokane, Washington. We're all about COVID, 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 COVID. You cannot go to the store, to any of the shop without a mask. My daughter turned 10 yesterday, so I took her for a birthday party across the state, Coeur d'Alene, 30 minutes drive. There is like nothing like coronavirus. I'm not kidding you. People are shouting, screaming, swimming, jumping. Nobody care about anything. You could wonder, are we in the same America? Because across the border is fine. This way is different. So I think, again, the virus will continue to spike. The point is, how do you prevent people from dying and getting sick from this? And the people we should protect is the elderly population, the people with pre-existing condition. And again, I said, we have cases of very young kids getting sick. We have cases of 20-year-old getting sick. These are outliers. I mean, they are not the routine. We all know that this virus is very dangerous for 65 and above, and people with pre-existing medical condition. So we have to wear our masks. Hopefully that if we get sick, if we get the virus, we don't get sick. We don't spread it beyond the people who are very, very vulnerable and going to die from this. That's my take on this.
Was the opening of lockdown, was the letting go of lockdown by most of the United States a mistake?
Yes and no. Yes, because yes, because people like the states in the South, Texas, California, Florida, did not even get to smell the coronavirus, and it was locked down. The states in the West, like New York and the West Coast, the virus hit, the lockdown was needed at that time. So going backward, I'm not the perfect public health scientist, but look at what's happening. This thing moved like tsunami. From Washington to New York, it was supposed to go down to Oregon, California, and go down the country. So people locked down prematurely at that time. Just like what happened in Africa, in Nigeria, for instance, there were 3 cases or 4 cases in the whole 180 million people who locked down the economy for 3 months. Now we're having thousands of cases every day. Nobody talk about locking down, opening up. So the point is that this will have come in, and they will lock down at the peak and they control it and those and protect. I mean, it's a difficult question. We don't know. I don't know.
Yes. Okay. Now, Dr. Stella, before we come to you, I think there are some people on the line who want to chip in. So if you're on the line, please chip in and we'll move on from there. Anybody willing to take up?
That participant, I think they had technical difficulties, but I want our doctors, Dr. Stella and Dr. Ogoji, to read the chat room. Sister Evelyn is posting questions there. So I think those who don't have the airways can post their questions on the chat room. I'm just directing them to that chat box. Back to you.
Yeah, you can read the chat room. I don't know where to read the chat room, so they can read it out.
I can read it for you. Do you think that...
Sylvia, go ahead. Let Sylvia read it.
No, the second one. Sylvia, the second one.
Countries have ended the lockdown. Maybe this will allow population to get immunity.
Yeah, anyway, by the time when we were talking earlier, like I was saying that lockdowns actually are supposed to stop, lockdowns do not stop the spread of the virus ultimately, or it do not stop the ultimate number of people that will get infected. And it doesn't even stop the ultimate number of people that might die.
Oh, die.
What lockdowns are supposed to do is to flatten the curve so that they don't overwhelm the medical system. And that's it. That is actually the whole issue of lockdown. It's to flatten the curve so that the medical system is not overwhelmed. Right now, the medical system is able to handle this because we are prepared with ventilators and whatever. But like I was saying, that the group that is getting sick right now are younger people that are less likely to have as severe a disease. But we're still at the preliminary stage, because if these younger people, if they don't protect the elderly and the vulnerable, these younger people will take the disease into their houses and give the elderly and the vulnerable, and they will get back to the tsunami of dying again. So if we lock down, if we can protect our elderly right now, I don't think there's a reason to lock down. We can continue social distancing, we can continue using masks or using hand sanitizers and whatever. But like I was talking to you guys, my take on this, from my experience and the experience of a lot of physicians that have been seeing this thing outpatient, and I'm going to give you as number one, we have been seeing coronavirus patients for the past 3 months, average 12, 10, 15, 12, 13, 7 in a day. And I have put my staff have been on hydroxychloroquine for the past 3 months. And even though we see that many coronavirus patients, the last time I tested them, nobody was positive. I did antibody tests, nobody was positive. So even though we have so much exposure, but we're under protection. I have another physician friend too that, she's actually going to be part of the video that we're doing. Because like I said, our topic is coronavirus outpatient management facts and fallacies. Number one, the reason why I strongly believe, and this is one of the things I'm going to say, and let the chips fall, not to you guys, but to the videos we're going to be doing and going out there. Number one, I believe that every single person should be on hydroxychloroquine. The same way we take it for malaria. You understand what I'm saying? The same way we take it for malaria, we should take it. And because the reason is that because this the mechanism of action stops uptake of virus and replication. And one of the studies that were done under Anthony Fauci was one of the in vivo studies. It was done in animals. They found out that the virus actually, replication was stopped in the laboratory and uptake. So that is why we think we should use hydroxychloroquine. And I think the message has been lost in the whole political craziness. They have done a lot of studies using hydroxychloroquine. We haven't seen any study yet that reported early use. The issue is early. From the patients that we've been seeing, if I see patients, if they come in within like the first 3 days of infection, and we put them on hydroxychloroquine, Citromax, and zinc, usually within 48 hours, they are better. If they come in after like a week, where they already begin to have some chest pain and some pneumonia going on, it takes them a longer time to get there. And so far, we've seen over 100 patients. So far, we've had maybe 4 of them end up in the hospital, but none of them needed intubation and none have died so far. I'm talking, these are patients, some of them in their 60s, some of them in their 50s, And then early in the beginning, before we started those regimens, we had a lady end up in the ICU and got intubated, but thank God she lived. The other thing that we do is that for our patients that are coming in that have been coming in a little later, and we start them on hydroxychloroquine, we give them Citromax, we try to see them on day 5, and we're collecting data on this, and we're about to publish it. But because things are getting so crazy, we have to do something. We can't be waiting for data to publish, because putting the data takes time, and people's lives are at risk. So we have this. When we come patients, usually by day 5, we'll be able to tell whether they are getting better or not. Sometimes if they are not getting better, we do add ivermectin. Ivermectin is an anti-parasitic that has also been shown to have viral properties. They use it in Brazil. So we've been able to add ivermectin, and then we'll now put this patient on doxycycline and put them on low-dose aspirin. Why? Because there's a lot of coagulation disorders that are found in this patient. So my take on this thing, and I'm taking from extensive experience of seeing this patient, is that, and of being in a situation where I'm taking hydroxychloroquine, my friends are taking it, all of us. We had one of our doctor friends that's going to be on this program that we're going to be doing. And thank God there's been, Pastor Pam, I've been doing this, and really, I've practically turned into an advocate, advocating it on YouTube, advocating it everywhere, talking on Facebook. And I think they've heard my voice somewhere, because a pastor from a very big church, thousands of members, got sick, and then they sent him to me, to my clinic, because some other people don't take care of him. So, and come to think of it, the guy that sent him was a physician that is I think he's the secretary of the National Republican Convention in the whole country. So yeah, so they are like, okay, good. Let's see whether we can get. So there are some doors that are really beginning to open for us to take this information out, because I believe that this is information that has been politicized that can help save lives. So we did this lady, her daughter got infected, so she went on hydroxychloroquine. She's a physician. Her daughter had one of the most virulent types, so they did her stool analysis. She stayed sick for like probably maybe 3-4 weeks before she got better, because she had gone to Spain, and then when she got to Italy, and then when she came back, But the husband and the wife stayed negative, and they took care of this child in the house actively, feeding her, doing whatever, taking care. They were at home with her. They didn't isolate her, but they stayed negative, and they stayed without any antibodies because of the. She's going to be one of the people that's going to be sending a testimony. The doctor that took care of nursing home patients in South Texas, he's one of the people. He's actually the RNC chairperson, and he's going to be part of the video we're going to be making. And he took care of, there were 50 nursing home patients, and when they got the infection and he found out about it, he did an EKG of all of them. He got them on hydroxychloroquine. None of them died. All of them lived. I don't know what I think, but one. But the one that died probably was not even had some complications. So we do have a lot of evidence, but so far with all the studies that have been done, we don't have any studies yet that have been on outpatient. I was talking about the Minnesota study. Minnesota study did something about prophylaxis, but it was prophylaxis for patients that have been exposed, and the prophylaxis started 4 days after exposure. Of course, the people got infected. So we are actually getting data to show that, number one, prophylaxis early, everybody should be on prophylaxis, low dose, every other week, because hydroxychloroquine actually has a 30 to 50 day half-life. So we're going to be putting them on low dose. And then number two, also just really talking on getting patients treated early. Early treatment is important. early treatment outpatient should be the way. And of course, those that don't get better can end up in the hospital, and of course, they can put them on remdesivir and other therapies. Right now, also, of course, they've just found out that they should keep on dexamethasone. I don't think putting patients on dexamethasone with a viral infection without giving them an antiviral or antibiotic might be a little dangerous. But putting them on a steroid, because steroids is going to cause anti-inflammatory, but if the steroid is stopping the inflammation, and there should be an antibiotic on board for some antiviral, so.
Yes,
we're using Nkemleke, so we're using it. Yes.
Yeah, thank you so
much.
I
would say that everybody needs to get on prophylaxis, and anybody that gets infected, find somebody that will treat you early with hydroxychloroquine. You'll be fine.
Yeah, Dr. Stella, thank you very much. One of our listeners has typed in a question asking about, well, he remarks that we're talking more about the United States than Africa, where our people are dying most.
Okay,
so when
let me say, in Africa, it's actually easy.
When shall we be talking about the peak and flattening the curve on the continent of Africa? So if we have ideas about how to do it in Africa, let's share that information.
Listen, in Africa, we are all used to taking chloroquine once a week for prevention of malaria. My parents are in their 80s right now. They're all on flavoquine. So I would tell all of our brothers and sisters, we don't have ventilators. All of our brothers and sisters, remdesivir is too expensive to even get to Africa to use in the hospitals. All of our brothers and sisters, the same way you have been taking quinine, hydroxychloroquine, mefloquine, thermoquine, flavoquine, whichever queens, I would say you have nothing to lose. We have used it for malaria. We've taken it with Sunday medicine for malaria. Take it with zinc. Zinc is a metal. Take it, you have nothing to lose. There's nothing, you can't lose anything by taking what you're already taking to prevent malaria.
And yeah, so real quick, I don't want to forget, Stella, take a few seconds, because we're running out of time, take a few seconds and share information how to contact you. It's very important. You are a special guest today. Please don't just take a few seconds, less than 1 minute, because we have less than about 2 minutes.
Yeah, I have a clinic in Houston, Rehoboth Medical Center. I think I have a flyer on the Facebook page, on our Facebook page, and Pam, you share it on the African Online Facebook page. We have a clinic. You can contact me on Facebook. I'm on Facebook, and you can call our clinic. We actually right now have I've looked with other doctors, and we have a nationwide telemedicine for people that want to get prophylaxis and treatment in other states. I think it's just 1 or 2 states right now that we don't have anybody. So contact me on Facebook. I will share our flyer on African Online. Contact me, and we'll be able to connect you wherever you are. If I'm not licensed in your state, we'll find you a doctor in that state.
Okay, great.
Thank you so much. Dr. Ogoji, maybe you should have a word.
Well, all I would say is in Africa, we should just try to protect the elderly population. We'll try and do basic hygiene. If we can take chloroquine, if we should, but if we have heart diseases, we should be careful. The key is hunger will kill more people in that country than COVID-19. We don't have the vulnerable population. We don't have the 80 and 90-year-old that will die a lot. They are mostly in the village, so they shouldn't close the economy for COVID-19. That's my take.
Okay, Evelyn?
Yeah, from my end, I think it's just to say that most African countries have terminated a lockdown. I think they're trying to get the population to get immunity.
Okay, thank you very much. Sylvia?
Since all learned doctors have said everything that I think can be said about COVID, I will retract myself from COVID, but just encourage everybody to be a part of the fundraiser that that we're putting together August 1st. And for those of you who are interested in being a fundraiser, please get in touch with one of us. Those of you who are online right now, I believe you have the Africa Online Media Corporation information. If not, please go on the Facebook. I'm not sure the website is up yet. I know it was being worked on. I'll give you an update next Sunday as to where we are with the website. So please come on. Let's raise this money. Let's get those boreholes in our African countries, so that our mothers and fathers and the rest of our family at least can have that clear, pure running water coming into the homes or somewhere closer to the house where they don't have to keep sending the girl child 10 miles away to go get water from the well. So please be a part of this fundraiser August 1st. Stay tuned. We'll be sending you some more information out. Some commercials are going to start coming in, some advertising as well. And yours truly signs off.
Reverend Pam.
Yeah, thank you so much, Sister Sylvia. Thank you, Dr. Stella, Dr. Ogoji. Thank you for pressing your way. I know you just got off another Zoom that you were chairing. Thank you, Evie, all the way from Freetown, and you know, you're all part of this fundraiser. You know, I just want to say, and yes, of course, you're always so faithful. I just want to say, this fundraiser we're doing, it's going to outlast COVID-19. We got this vision 3 years ago. It had nothing to do with the pandemic. Every human being is entitled to clean water. It is not a luxury. It is a necessity and it's a right. So keep that in mind. Don't be comfortable in your home because you take water for granted. Some of us, when we are brushing our teeth, I used to do that until the city of Houston sent letters out that we should turn off the water when we are brushing our teeth. I used to be one of those people that when I'm brushing my teeth, the water is just running. It runs until I'm done brushing my teeth. So because of that letter from the city of Houston, when I'm brushing my teeth, I turn off the water. I only turn it on when I'm using. Let's conserve water because there are a lot of our brothers and sisters who do not have access to water. And this water is a life-transforming gift from you. Be a part of it. Become a donor. I just want to say, those donors that are going to give us $1,000 ahead of the broadcast, the event, the live event, will acknowledge you live on the air. And for those who have issues with sponsorship, let me tell you, it's a lifetime sponsorship. We're not going to say your ad is going to be on that show, on that program. So even if somebody watches it a year from now, they'll still have your ad there. So you talk about a lifetime ad for just a chicken feed for people. So keep that in mind here, so.
Dr. Stella, last word, please.
Well, like all the doctors will always tell you, maintain social distance. Prevention is always better than cure. Wash your hands, put on a mask. I know a lot of people are going on and on about masks. Wash your hands, put on a mask, be safe. If you don't need to go out, don't go. If you don't need to get into crowds, don't go. Stop the parties. We can do parties later when this thing is over. And of course, everybody that was listening to this fundraising, we need to take care of Africa. So everybody that's listening, do your part. If everybody can do their part, we can always come out on strong. And for all of my brothers and sisters in Africa, please, this is not time to party. Be careful.
Thank you so much. The word is be careful. Watch out, watch out, watch out. Wash your hands, wash your hands, wash your hands. Social distance, social distance, social distance. Thank you all very much for coming in today. We look forward to being together again next Sunday. But during the week, please watch out for posting of the new topic and please chime in on the WhatsApp group if you can, so that by the time we get on the discussion online, we will have heard or learned something before we come on the discussion. Thank you all very much. My name is Asonglefac Nkemleke, and we'll see you next Sunday.
Please say it in French. Close that in French also.
Je vous remercie de la part de Africa Media Corporation, Africa Online Media Corporation. Comme on venait de vous dire tout à l'heure, nous allons avoir un coup de cœur pour construire des points d'eau en Afrique. Merci beaucoup, bonne semaine et restez fidèles à Africa Online Media Corporation. Au revoir.
Voilà. Voilà.
Au revoir.